Technician Training course for the Ultraslim Professional. An introduction to Ultraslim. Hello, and welcome to your Ultraslim Professional Training course. Congratulations on becoming involved with the latest exciting new fat loss technology available. Thank you once again for leasing our device, and we are delighted to welcome you to the Ultraslim family. We hope you are as excited as we are. We want our providers to do well, so we strive to help you be as successful as possible from the very start. During this training, we will cover everything you need to know in order to begin your Ultraslim service. This will include: what is the Ultraslim Professional? A comparison of competing technologies. How to handle a consultation with a patient. Correct documentation and paperwork. How to perform a treatment including recording measurements, taking photographs, positioning the patient and using the device. How to optimize the patient's results. How to perform skin treatments. At the end of this session, you will have the chance to practice the areas we have covered during the hands-on element of the course. How does Ultraslim work? Our technology is based on modulating a specific type of narrow-band, non-coherent light. The modulated light tricks the mitochondria in the nucleus of the fat cell into creating a transitory pore in the cell membrane, allowing the fatty acids and triglycerides to escape into the interstitial space. The liberated fat cell contents are then drained by the lymphatic system and processed by the liver and kidneys as a part of the body's normal course of detoxification. The pore in the fat cell will close in about 48 to 72 hours, and the liberated contents will be expelled in the client's waste over the next few days. Here you can see the process of lipolysis taking place in a cell. Notice how the cells drain, then collapse, taking up significantly less space. This is what provides the immediate inch loss after treatment. How is it different from other lipolysis-based devices? As a dramatic improvement over laser lipolysis, the photonic energy of Ultraslim is not limited to a single pinpoint or scanning pinpoint. Using a non-coherent light, Ultraslim Professional's 150 diodes safely delivers 7.8 times more photonic energy than lasers and delivers a total luminous flux dose of 10,035 lux minutes uniformly to an area up to 23 by 17 inches. The light is produced by our patented narrowband light-emitting diodes, which concentrates the photonics energy at 635 plus or minus 2 nanometers with selectable exposure time of 8 or 20 minutes depending on the indication for use. Ultraslim versus all other body slimming treatments. Ultraslim has become a popular trend. This has led to many treatment options that may seem harmless but actually have hidden dangers or side effects. Ultraslim causes no cellular damage. The fat is simply removed from the cells, unlike the alternative procedures based on apoptosis, the killing of fat cells, which damages the body. Most other body slimming technologies rely on cellular damage, even if they are considered non-invasive. The dangers of destroying fat cells. Many people are under the misconception that destroying your fat cells will stop you from ever gaining back any fat. That is simply not true. While it is correct that fat can no longer return to the cells that have been destroyed, it will simply find a new place to go. Many patients who destroy their fat cells on their abdomen will see an increase in fat accumulations in other areas such as their thighs or back. In some cases, the cell removal or destruction can be uneven, leading to lumps or other dysmorphic fat accumulations. In one case, a man had all of the subcutaneous fat cells, the soft upper layer of fat, microwaved off in an experimental treatment. He was no longer able to send his fat to any of these cells, so instead, the fat built up in his visceral fat cells, body of fat that is stored within the abdominal cavity. So even with all of his subcutaneous fat cells destroyed, this man still totes an impressive potbelly. Destroying your fat cells is not the answer. Draining fat from your cells using the body's natural fat removal process is the only solution that does not leave you worse off. Ultraslim has no side effects. Most alternative technologies and devices have mild to extensive side effects. Many patients want a safe, natural alternative. The UltraSlim Professional is the only Risk Group 1 body contouring device available. This is the same risk group as a tongue depressor. Patients do not need to worry about any pain, downtime, or adverse outcomes. The red light poses no damage to the eyes. UltraSlim works. UltraSlim treatments are effective on 100% of patients. Clinical trials show that 98% of patients lose 2 inches or more from their waist, hips, and thighs combined after only 1 treatment. The average inch loss from this area is 3.5 inches. Many patients lose even more. UltraSlim can be used for dramatic, substantial fat loss, simply to target those small, stubborn areas, or any goal in between. Unlike other devices, this technology is suitable for very large patients. UltraSlim Protocol. Initial consultation. The consultation is your first time to really sit down with a potential patient and discuss the process. A consultation generally lasts around 30 minutes. You will schedule a consultation whenever someone would like further detailed information or to discuss their options. For a patient who has already booked a treatment, in order to develop a personalized photo. Consultation objectives. Introduce yourself and your company. Get to know your patient. Identify the patient's goals, expectations, and motivation. Explain the UltraSlim process and how it works. Discuss treatment plans. Provide pricing options. Tell the patient how to prepare for treatment and what to expect. Discussion objectives. What is their self-image? What are their problem areas? How did they come to have them? What are their goals and expectations? Is there a time frame they would like to work to? What motivates them? What is important to them? Ask if they are willing to show you their problem areas. Provide reassurance that you have helped others with similar issues and that you can help them too. What is the solution? After identifying their problems, jointly develop a treatment plan that works towards their goal. Show before and after pictures of similar treatments. Create realistic expectations. Discuss promotions and pricing. Schedule appointments. Provide relevant documentation in the client procedure guide. How to sell. To prepare to sell, please go to the Marketing and Selling Services document written and prepared by Terry Ward, MHA, the inventor of UltraSlim and CEO of Ward Photonics. This can be found in the provider's portal on the My UltraSlim website. The required paperwork. You will need all of the following paperwork for each patient: health history questionnaire, admission goals form, client procedure guide, receipt of services, measurement form. Check with the training staff if you do not have any of these forms in front of you. Health history questionnaire. UltraSlim can be used on any generally healthy adult. A contraindication is a condition or factor that serves as a reason to withhold a certain medical treatment due to the harm that it would cause the patient. Have the patient read the form and fill out any contraindications they may have with a simple check mark. If the client does not check any of the contraindications, you are ready to move on to the next step. If the client checks any of the contraindications, a doctor will need to make a determination on whether or not they should be treated. Admission form. This should include name, address, email, phone, where they heard about you. Use the second half of this form to record goals during consultation. Client procedure guide. The client procedure guide should contain all of the following information and acts as a contract between you and the patient. information about the chosen treatment, preparation instructions for the first treatment, advice for treatment optimization, details of the 2-inch loss guarantee, a space for the patient to sign on the last page. Receipt of services. This document will confirm the validity of your 2-inch loss guarantee. Be sure to use after the first treatment session. Fill in the number of inches lost. Complete all lines. Be sure to use ink, no whiteout. Example: today I had a non-invasive body slimming session and lost 2 inches in total from my waist, hips, and thighs, which exceeds the 2-inch loss guarantee. I am satisfied with the services which were provided as described, and I waive any rights to a refund or chargeback. Measurement form. These forms are used to keep track of all measurements. This form can be found on the provider's portal on the MyUltraSlim website. Use the measurement calculator to fill out the form. Use the provided form, do not create your own. Date every entry. Fill in every information box. Measurements. Start with the right tape measure. Always use the recommended tape measure to ensure the accuracy and consistency of your measurements. Digital tape measures similar in appearance are not advised, as results could be affected. The accurate recording of measurements and reference points is crucial. Use your tape measure properly. Hold the tape measure with the button and hole facing upwards in your left hand. Hold down the tension button and it will give you more tape without clicking. Feed the tape out smoothly without letting the tape go slack. If you try to extend the tape without holding down the button, your accuracy will be reduced and you will encounter loops of tape falling off the body. Prepare the person you are measuring. Posture. The patient needs to move any waistbands and clothing away from the area being measured. There should not be clothing within an inch of the measurement area. You may lose accuracy, but you might also choose the wrong place to measure. Have them stand up straight, with their elbows raised and their hands on the collarbone. Tell them to take a deep breath in, a deep breath out, and then just breathe normally. How to take a measurement. Choose where you are measuring, measure across the body. Your measurements may not be accurate if you do not keep the tape measure straight and level with the floor. Holding your tape measure in your left hand, push down the red button and extend the tape measure behind the body. Holding the button down, pull enough tape out to cover the back and just a little more than you need to get it around the sides of the body. Still holding the button down, bring the tape around the patient, being sure not to pull or pinch the skin. Make sure the tape is snug against the fat, but avoid excess tape, which can result in a hanging tape measure. Once you have wrapped the tape tautly around the body, continue to pull the left side, while holding the right side stationary. Bring the tape measure to the plastic rod and place in the hole. Let go of the red button. The tape measure should be taut enough to stay on the body. Run your fingers through the tape measure to make sure that there are no air bubbles or overly tight places, that there is consistent tension along the tape measure. Press the red button in and record your result. Do not remove the tape from the body yet. Female measurements. Identify where you are measuring. Identify the largest apex of the fat that you will be treating. Make a mental note of where her apexes of the fat are. If this area is reduced during treatment and you took the correct measurement of this area, you will observe a smaller measurement post-treatment. Imagine you are treating our example above. Observe where the apexes of the fat are: the sides of her body, her thighs, her buttocks, and her back. You will want to strive to measure all of the apexes of the fat where you will see the greatest losses. Your training technician will now point out where, on the body, the largest apex points are. The back measurement. The first measurement is designed to record the largest apex of the fat your patient has on her back. Typically, this will be on the rib cage below the bra line. Choose the largest apex of the fat where you will see the most loss. Back. Do not choose your measurement area using rules such as where the bra line is. Choose where the largest apex of the fat is. Mid-abdomen. You want to measure her belly apex of the fat rather than the slimmest point, often referred to as the waist. Typically, this will be near the belly button, but often slightly below. Be sure to include the apex of the fat on the sides and back. Do not pick a lean section of back as this will reduce recorded results. If you take this measurement from too high up on the body, you will reduce recorded results. Remember, you are measuring the largest apex of the fat. Lower abdomen. This measurement should record the lower apex of the fat. It should also include the side and back apexes of the fat in the section of the body. This is often where pregnancy fat will accumulate or where rolls form above the underwear line. Hips and buttocks. Consider the apexes of the fat around her hips, the front and sides of the legs, and the buttocks. Exactly where you take the measurement will depend on that individual's body and fat distribution. Thighs. For this measurement, the patient will need to slightly widen their stance. Record the distance between the feet for accuracy. Choose the largest apex of the fat area on the thigh, considering the apex of the fat around the whole leg, including the backs and inner and outer thighs. Measure each leg separately, as the fattiest areas may differ between legs. If you measure below the apex of the fat, you will have significantly reduced results. Male measurements. Identify where you are measuring. Identify all of the apex of the fat that you will be treating. Make a mental note of where the apex of the fat is. If this area is reduced during treatment and you took the correct measurement of this area, you will observe a smaller measurement post-treatment. Imagine you are treating our example above. Observe where his largest apex of fat is, the sides of his body, his chest, his hips, and his lower back. You will want to strive to measure all of his pockets of fat where you will see the most loss. Your training technician will now point out where on the body the largest apex points are. The back and chest measurement. The first measurement is designed to record his apexes of fat on his back and chest. Typically, this will be on or just above his nipples. Choose the largest apex of the fat that will see the most loss. Back and chest. Do not choose your measurement area using rules such as where the nipples are. Choose the point where the largest apex of the fat is. Upper abdomen. This is to measure his upper belly apex of the fat. Typically, it will be a few inches above the belly button, but be guided by that individual's body. Be sure to include the apex of the fat on the sides and back. Do not pick a lean section of the sides and back, as this will reduce recorded results. If you take this measurement too high up on the body, you will reduce recorded results. Mid-abdomen. This measurement should record mid-belly apex of the fat. It should also include the side and back apexes of the fat in this section of the body. This is often where men consider their waist measurement to be. It is important that the side apex of the fat be included in measurements for significant loss. Lower abdomen. Many men acquire fat around their lower belly. This is the target apex of the fat to be measured, along with the apex of the fat on the sides of the hips and the apex of the fat band along the lower back. These areas of fat will determine where this measurement is taken. Flanks. It is important that you take this measurement low enough. If you do not, you will not capture the targeted fat. The apex of the fat above the pubic area, above the buttocks, and the soft apex of the fat along the low hip area is your target apex of the fat. Photographs. Why take pictures of everyone? You will want to learn how to take quality photographs. You can use good pictures for effective marketing to assist in sales. You can use pictures to track progress and increase customer satisfaction. Tips for great photos. Use consistent lighting. Use consistent underwear in pictures. Use the flash. Make sure every area treated is visible in pictures. Use consistent posture and positioning. Set up standing spots on the floor. Use a background. A dark solid color works well, but do not use black. You may wish to put your name or logo on the backdrop. Use a color that works well with many skin tones. Install a diagram. Use tape or adhesive labels on the floor as markers. Using a diagram ensures consistent positioning for both the patient and the photographer. Mark where you will be standing to take pictures. Choose this place based on your camera. Always position the patient with their hands up on their collarbone parallel to the floor. Take 4 photographs. Number 1, front of the body. Number 2, right hand side. Number 3, back of the body. Number 4, left hand side. For patient privacy, avoid capturing their face when taking pictures for body treatments. Front side of body photo. Be sure to only capture the area of the body that is exposed and treated. Right side of body. Be sure to only capture the area of the body that is exposed and treated. Left side of body. Be sure to only capture the area of the body that is exposed and treated. Back side of body. Be sure to only capture the area of the body that is exposed and treated. Standing position. Make sure your patient stands correctly on the foot placements. Have them place their hands up to the collarbone, elbows straight and parallel to the floor. Ask them to stand tall, take a deep breath in, and exhale slowly. Then ask the patient to hold for the flash. Placements for your camera. Have visible tape placements where the camera will be. Be sure you have room between the camera and the wall to move about. Distance for each foot placement. Please be sure when placing tape on the floor where patients will stand to measure the same distance from each foot placement. Remember, we want the patient to be consistent with where they are standing and how far apart their stance is before and after treatment. The approximate distance between the right and left foot placement for all shapes and sizes is 20 inches. Treatment. Prepare. The red light does not work through fabric, so any areas of the body that are covered should not be included in the 2-inch loss guarantee. Even excessive body hair could act as a barrier, so male patients may wish to consider shaving the area to be treated. The patient should avoid wearing skin lotions, especially sunscreen. Cover any area where fat loss would be undesirable, such as the breast or male genitals. Cover all requested areas and do not assume the patient's underwear or clothing will be sufficient. Upholstery vinyl is our recommended material to use as a cover. You can find vinyl at craft or fabric stores. Cut a square of vinyl to the size of a pillowcase. Line the pillowcase, then fold over 4 times lengthwise and drape over the area. Have several covers available. Other fabrics can work, but if you can see through it, then it may not be effective at blocking the light. Frequency and duration. Treat each area for only 8 minutes per session. More time does not mean more results. Standard treatment frequency is once a week. You need to allow time for the body to fully process and rid the system of the released fat before the next treatment. Remember that the fat cells remain open for up to 72 hours after treatment and continue to release their contents, which in turn need to be eliminated. It is possible to perform 2 treatments per week if the patient is seeing only small reductions in measurement, as long as enough time is allowed for the process to occur. When combined losses exceed 6 inches, do not treat more than once a week. Protocol Waistbuster treatment. Price for the patient is $500 per visit. They will spend 32 minutes under the light. This consists of 4 exposures, 8 minutes to the front, back, and each side. The treatment is designed to treat a 23 by 17 inch area around the whole circumference of the body. Treat at 2 to 8 inches from the skin. Positioning. Identify all of your target areas. Position the device so the light is over all target areas, then turn it on. Lower the light until all of your target areas are illuminated and the light is not directed onto the table. With your glasses on, you will see the shadowed line defining the areas that will be treated. This will assist in positioning the light correctly. Exposure 1. Position the patient on their back. Treat from below the bra to the top of the thighs. Have patient bring their feet together and rotate their thighs apart to target their inner thigh measurements. The position assures exposure of all 6 measurement points from the thighs to the back measurement. Exposure 2. Position the patient on their front. Treat from the back measurement down to the thigh measurements. Widening the legs slightly allows the light to reach the inner thigh. Exposures 3 and 4. Ask the patient to lie on their side with the pelvis tilted back about 45 degrees and the lower leg bent at the knee. The light is aligned to cover the side of the waist and abdomen, the outside of the top thigh, and the inside of the lower thigh. Repeat on other side. Male positioning. For male patients, the light is moved several inches higher up the body than on a female. in order to treat the chest area rather than the buttocks and thighs. Exposure 1. Laying on his back, position the light to cover the top of the chest down to just above the groin. Cover the groin with the vinyl. Exposure 2. Laying on his stomach, position the light to cover the upper back down to the top of the buttocks. Exposure 3 and 4. Laying on his side, position the light to cover from under the arm down the side of the body to the lower waist. This also treats the abdomen from each side. Am I doing it right? Step 1. Choose target areas based on where you have measured. Step 2. Position so there is an adequate light being exposed to the fat to ensure the whole area will be treated. Step 3. Expose for 8 minutes. Treatment optimization. Steps to results. Be realistic with your patients. Under-promise and over-deliver rather than the other way around. Devise a treatment plan based on that individual. Adapt their plan if necessary, depending on their results. Always focus on inch loss and body contouring, not weight loss, as this depends on how effectively each patient is able to eliminate the released fat. For best results, take a week off after 4 treatments before a further 2 treatments rather than having all 6 sessions without a break. This allows the body a chance to fully eliminate any remaining fat. The lymphatic system. After each treatment, use the vibration plate for 10 minutes. This encourages the liberated fat to move around the body. Keep hydrated. Each patient must drink at least 2 liters of water each day to help stimulate and flush out their lymphatic system. Reduce dehydrating lifestyle aspects by limiting caffeine, salt, high sugar foods, and alcohol. Lymphatic drainage massage can also be beneficial. Liver function and supplements. The more capacity the liver has to detoxify, the greater the results for the patient. Milk thistle and non-flesh niacin can help boost liver function. Milk thistle, 1,000 milligrams twice daily. Slow-release non-flesh niacin, 500 milligrams per day. Cut out all alcohol. We cannot stress this enough, as alcohol reduces liver function and will affect results. Diet. We advise reducing highly processed or fatty foods to avoid placing a strain on the lymphatic system. Patients may notice an increase in bowel movements, so high-fiber diets are suggested to help with this. Crash dieting and highly restrictive food programs are not recommended. The patient can maintain the results through lifestyle choices, so we suggest reviewing their diet with them prior to completion of their treatments. Exercise. Try to exercise within 3 hours of treatment. This is not from a calorie burning perspective, though of course this will only help improve results, but to get the body moving and stimulate the lymphatic system. If the patient already exercises vigorously, they can continue with their usual routine. If they are not currently exercising, begin walking 30 minutes each day. Remember to drink plenty of water while exercising. Compression garments and shapewear. These can assist in releasing the fat from the cells and guiding the shape of the body while the treated fat cells are malleable. The patient should wear the garment for around 8 hours a day, ideally during the daytime, from right after the first treatment until a week after the final treatment. Ensure that the compression garment shapes the body in a way the patient wants their body to remain. At the end of this presentation, we will be happy to provide you with information about where to obtain reasonably priced and effective compression garments. Skin rejuvenation. Skin rejuvenation treatments on the body produce results such as improvement in skin texture, less noticeable blemishes, a toned and tightened appearance, smoothed and plumped skin. Non-invasive facelift. The light is safe to use on the face. Reduces lines and wrinkles, evens skin tone, makes skin look much younger, tightens the neck and jowls. Non-invasive facelift. The patient should clean their face so their skin is free from makeups or creams. Position them with their head turned to one side with no clothing covering the neck area. Place the light at a distance of 6 to 7 inches away from the skin. Treat each side of the face for 20 minutes. You can treat as often as daily. Maintenance. Unlike the fat loss treatments, the results of skin treatments are not permanent, so maintenance sessions are recommended to continue to boost the production of collagen and elastin. To maintain effects on skin, rejuvenation treatments are suggested once a month. Prices. Skin rejuvenation, $149 per visit. Non-invasive facelift, $500 per visit. Package discounts are common, and you may wish to consider maintenance sessions as a part of the package. Ultra Smooth. Ultra Smooth is designed to diminish the appearance of cellulite. For women with the orange peel, like cellulite, this treatment is ideal. There are 4 components to the Ultra Smooth treatments. This is a risk group 3 device, which means you will need protective eyewear. You will need Ultra Smooth device, green IPL safe goggles, cordless massager, embolism pantyhose. Ultra Smooth treatments should be administered 3 times a week for 2 weeks. Find the cellulite on the body, back of thighs, side of thighs, front of thighs, stomach. Take photos of the area with cellulite before the first treatment and after the last treatment before massage. Then again 2 days after their last treatment. This will be one way to show patients the change in cellulite over the series. Schedule full series of treatments on the first day. Position light as close as possible within 1 inch without touching the patient. Treat the area for 20 minutes. Massage the treated area for 5 minutes. Then have the patient put on the embolism pantyhose.